The Western Kentucky Heart and Lung Research Foundation is a non-profit organization which is a collaboration between Western Kentucky Heart and Lung and the Medical Center Bowling Green. And we have close support from the UK School of Medicine in Bowling Green and Western Kentucky University as well. The purpose of Research Foundation is to promote scholarly activities and research activities in a busy community program like the Medical Center. And we're also trying to educate our public at South Central Kentucky about primary prevention and other lifestyle changes. Since we have been in the middle of COVID pandemic, our focus has shifted from medical research to entirely about COVID research. So we're researching COVID at different levels. We're looking at the COVID patients to see if we can identify some characteristics in these patients which could help detect this disease early on so we can intervene and prevent them from getting so sick. Numbers like their lab values, their blood testing, their EKGs, their echocardiogram. We're also looking at other disease processes like acute heart attacks and strokes to see how COVID has impacted patients with these acute conditions. Patients with acute heart attacks, we have found out, are waiting longer to come to the hospital because of the fear of contracting COVID. People are coming here with bigger heart attacks, they're sicker. Through this study, we are trying to educate our people to not ignore the signs and symptoms of other acute conditions like the stroke and the heart attacks. So we have designed a research study which is a survey-based research which will be distributed to all our patients to assess how satisfied they were with their televisits and see how we can serve them better through telehealth. We're also looking at the psychosocial and psychological impact of COVID in our patients. The COVID-19 disease is spread mostly in the community, so there's a lot of fear about contracting this disease in the hospital setting, which I would say is not true. So people just need to be very careful when they're going to the grocery stores. We need to maintain social distancing, good hand hygiene, and good infection protocol.